Hillsborough County has launched its redesigned website, hcfl.gov. The new domain boasts a variety of improvements to searchability, page layout, navigation, and website speed. The revamped website features robust search functions, making it easier for users to find the information they need. Whether searching for essential government services, paying water bills, accessing event information, learning how to acquire a new trash can, or identifying evacuation zones, the enhanced search functionality ensures quick access to relevant content. HCFL.gov's new design features a clean, modern, and intuitive layout. The streamlined design enhances user-friendliness for easy navigation and access to important resources. Navigating the website is now more straightforward than ever. Users can seamlessly move between different sections, departments, and services while interacting with information and resources. Ready to see what all the fuss is about? Head to hcfl.gov and discover your best source for all things Hillsborough County.
Hey, the new house looks great. How are you liking it here?
Well,
You wouldn't expect this in your home.
What?
Why on earth would you do it in ours? Hillsborough County put waste in its place.
Good afternoon and welcome to the May 8, 2024 Hillsborough County Board of County Commissioners Budget Workshop. This is the third in a series of workshops that the board will be having in advance of the county administrator presenting her recommended budget. Before I pass things over to Ms. Wise to make some opening remarks, just want to say that Commissioner Kemp is participating virtually. However, it's my understanding that we don't need to do a roll call vote. So with that, Bonnie, you want to make some opening remarks.
Thank you. And as you mentioned, Mr. Chair, today is the third budget workshop, and I'll be delivering the County Administrator recommended budget on July 17th. The workshop today will cover a brief overview of the fiscal year 25 budget process, presentations on public safety, and the presentation on the status of the county's indigent healthcare plan, including options to rebalance the program based on recent changes in annual revenue generation. As with all workshops, today is for information and discussion, and no votes will be taken. We welcome feedback from the board on this year's budget process and any additional workshops and topics that you would like to have scheduled. A primary focus today will be discussing, as I mentioned, the Hillsborough County Indigent Healthcare Plan. Over the last few years, sales tax revenue collections have risen significantly. This revenue increase, combined with higher interest earnings and the stabilization of program expenditures, have resulted in a rapid increase in healthcare plan reserves. This is compounded as revenues exceed expenditures annually. We have a full agenda today with several speakers. Kevin Brickey will begin with a brief budget overview. With our focus on public safety, we will then hear from Chief Deputy Thomas St. John from the Hillsborough County Sheriff's Office to discuss their budget forecasts and their challenges. Fire Chief Jason Doherty will provide an update on their initiatives to save lives and protect property by reducing response time. We'll have Carl Harness and Jean Early to provide the board with an overview of the healthcare plan, and Kevin will discuss the reserves and potential funding options. Then Dr. John Curran, chair of the county's Healthcare Advisory Board, will cover a list of options to rebalance the program's operations. With that, I'll turn it over to Kevin Brickey.
Good afternoon, Kevin.
Good afternoon, commissioners, and thank you, Ms. Wise. As Ms. Wise said, I'll be giving a brief recap and update on the current state of the budget and our efforts to move forward into FY25. I'll remind everyone that the FY24 budget, the current budget, is about $9 billion. 24% of that is of the operating portion, which is $3.6 billion. 24% of that is for public safety, sheriff operations, and fire rescue operations. The next largest area is our enterprise funds at about 14%. That's our water, wastewater, and solid waste operations. The countywide general fund is about $1.4 billion. In that area, about 55% of the countywide general fund funds our constitutional officers and outside agencies. The sheriff's court and jail operations are in this fund. And then with other constitutional and outside agencies, about 55%. Turning to our unincorporated area general fund, which funds services, city-type services within the unincorporated area. Here we have law enforcement for the sheriff, and we also have fire rescue. Those two are by far the largest areas, public safety, and that accounts for about 71% of the unincorporated fund. Our capital improvement program for FY24 only is about $1.6 billion. The largest areas are water enterprise at about 34%, transportation at 23%, and parks at 10%. So those three combined are about 2/3 of our FY24 capital program. As we look to building the upcoming recommended budget, we keep some guiding principles in mind. One is that, of course, we need to adopt a structurally balanced budget where recurring revenues match recurring expenses. We look to using restricted funds first. Those are funds that are restricted to a specific use, as opposed to general funds that can be used for a wide range. So we try to use restricted funds first where appropriate. We look to maintain our general fund reserves at 20 to 25% per board policy and rating agency preferences. Maintaining county infrastructure and equipment. maintaining our current service levels. So just maintenance of what we have now is important, and county employees, investing in county employees and maintaining our relationships there. In FY25, some of our current highlights, we estimate right now that taxable values will increase about 5.5%. That feeds into property tax revenue. That is a bit lower than recent years. In FY23, we had about a 15% increase, FY24, an 11% increase. So we do think we'll have a little bit more constrained revenue growth, and also in sales tax as well, and state shared sales tax be flat to maybe a modest 1% growth. As Bonnie mentioned, we've had some strong revenue growth recently in sales taxes, as those have exceeded expectations around the country. And also interest income, as interest rates have been high, as inflation has remained high and the Fed has kept interest rates elevated. So we do think that will offer some opportunities for some one-time capital investments in the FY25 budget. And we would focus primarily on areas that would have a limited ongoing operating impact. And then we would continue to make budget decisions based on those guiding principles. We're looking at implementing strategies and items that would begin to rebalance the Indigent Healthcare Fund. That'll be the subject later today, of course. Strategically investing community investment tax revenue and state shared sales tax revenues, and also consideration of a millage swap between the countywide and unincorporated funds that would allow for some additional investments in public safety, particularly in that unincorporated fund. And just as a reminder, this is a slide that we've shown before, some examples of millage swaps. It's not a one-for-one swap. Based on last year's taxable values, a swap of 0.1 mil, which would be a reduction of 0.1 countywide and an increase of 0.1 unincorporated. The countywide fund would lose about $15.7 million. The unincorporated fund would gain about $9.3 million. There'd be a net loss of $6.3 million because, of course, that unincorporated millage is not levied within the three cities. So in effect, there would be a tax cut within the boundaries of the three cities. And that would show as the impact on a house. This is looking at a homestead with an assessed value of $350,000. Within one located within the unincorporated area, there would be no net change in taxes, but at a tenth of a mil for a homestead located within the cities, the countywide reduction would be a $30 drop in property taxes. There would be no change in unincorporated because, of course, it's not charged there, so it would indeed be a $30 total decrease in taxes for that particular type of homestead within the city boundaries. And then as a reminder of the calendar, this is our third budget workshop, as the chair mentioned. We will be looking for the property appraiser estimates. We'll get two, one on June 1, July 1 as well will be the preliminary numbers that will go into the adopted budget. And Bonnie will be delivering her recommended budget to the board on July 17th. We'll have our budget reconciliation on July 31. And our two public hearings required by the state are September 12th and September 19th. And of course, if the board desires, we can have additional workshops as well through the summer. If there's any questions, I'd be happy to take them, or I can hand it off to the Chief Deputy.
I don't see any questions right now. Thanks, Kevin.
Thank you. Thank you.
afternoon.
Good afternoon, everyone. Thank you for allowing me the time to speak today. Give you a quick snapshot of our sheriff's office. So here we have our overall budget for FY24 is $612,830,640. And our new budget submission for FY25, if approved, is $653,302,922. That's a 6.6% increase. Oh, I'm sorry. I forgot that part. Yeah. Thank you. A quick look at our unincorporated population based on Plan Hillsborough. We've divided it into our 5 districts. So as you can see, according to Plan Hillsborough County has experienced an 18% population growth since 2015. The rapid growth has created a challenge in all facets of operations for us. As we look at our calls for service since 2021, our calls for service have increased by more than 763,000, which equates to a 40% increase in calls for service. This increase has a ripple effect across our agency, which affects our response times. So as we talk about our response times, not only are our deputies feeling the pressure of the growing population, but our citizens are being affected by our slower response times. As you can see, our response times have increased by 4 minutes and 52 seconds since 2021. The reason I point that out is so I can talk about some manpower concerns. So FDLE creates a comparison across the state, and they develop a ratio of the number of officers per citizens. So when looking at the agencies comparable in size across the state, or our local agencies around our community, you can see we have the lowest officer to citizen ratio. Being the leading law enforcement agency in the county, others look to us for support and assistance, which further takes away from our manpower needs. Highlighted here, you'll see that we currently have a 1.2 ratio of officers per 1,000 citizens, while other local areas have a larger footprint in their respective communities. So how do we narrow that gap? Created a slide here, and it's our projected manpower count as we go into the future. Due to our current robust and successful recruitment, by the end of fiscal year 25, our current vacancies will be filled, leaving us with no ability to hire more people. In FY26, we aim to implement a plan to increase our officer-to-citizen ratio in order to grow with the population we serve. As you can see, to simply maintain the current ratio, we would need to hire 26 positions a year. In order to increase our ratio to the FDLE state average of 1.68 per 1,000, we need to hire at least 115 law enforcement positions over the next 5 years, beginning in FY26. So we're looking ahead. Our Department of Detention, our detention services is also impacted. Our detention has a steady increase in population over the last 5 years. With our growing population, we're nearing our max capacity. Moving forward, we'd like to remain competitive with the recruitment and retention of our deputies. Highlighted here are local agencies surrounding our county who draw from the same pool of applicants that we do. I would like you to look at just Manatee and Sarasota counties who are currently hiring starting deputy positions at more than $11,000 above our current deputy positions. As we move toward the future, we're going to need to remain competitive because that's paramount. So in a quick closing, just to recap, the county's plan, Hillsborough, shows the 18% growth over the last several years and the additional 38% growth as we look forward to 2050. We've only increased our manpower by 1.67% between 2015 and 2023. And the Sheriff's Office is currently actively seeking to expand its workforce to meet the growing needs of the community. That's all I have. Any questions?
I think so. Commissioner Cohen?
Thank you, Mr. Chair. So your 6.6% increase request,
Yes, sir.
what will that get you in terms of the progress that you would make toward hiring the number that you would need to start to reduce the response times?
Currently, in this request for this FY25, we are not asking for additional positions. We have enough vacancies right now that'll carry us forward to the end of this fiscal year. So we're just trying to, I guess, more prepare the board as we look forward to the future.
Okay, but this is what you need to keep operations going for just the year ahead then, is the
Yes, sir.
6.6?
Yes, sir.
But we should expect steeper rises in the future?
Yes, sir.
Yeah, okay, thank you.
Yes, sir.
Commissioner Owen?
Thank you, Mr. Chairman. And first, thank you for being here. Thank you for all you do to keep us safe. You guys are the real heroes of this county, you and our firefighters here. So I'm the one that wanted you all to be here today, because I think it's important. We have fire here a lot, but we need your perspective too as well, because you know, I have major challenges in my district, right? I don't have to tell you. And with the growth, I mean, what I need on my side of town are more deputies, right? The jails are a source of funding, but then also on my side of town, it's we need to fund our deputies, right? To have more deputies. So my understanding is that we're going to need a certain amount of deputies in the next, is it 4 to 5 years, that we've been discussing with our staff, and we have kind of a plan for that, Bonnie. Is that safe to say, or?
Well, a plan for that
Okay.
is, I'm not sure we quite have that completely underway.
Yeah.
But I think what I appreciate from the sheriff's office is that they're not surprising us. So we are good partners, and so for this coming year, fiscal year 25, as was mentioned, we're okay, but they have been, in order to keep their ratios, they're going to have to add some positions. And so they're telling us now so we can start to prepare for that into the future. Exactly how many and how we're going to fund that we haven't exactly figured out yet, but I appreciate that we have a year to help plan for it.
And do you know how we're going to, I mean, and maybe this is premature talking to you about this, say the number's 150 over a period of time. Are we going to try to come to that within this budget cycle, that having that knowledge so that we can start planning, or is it pretty fluid where we don't really know? Because look, I know we got challenges with growth, not really being able to exactly estimate where all the growth is, but we really kind of know where it's going. So.
Well, I think that, you know, as you mentioned, we hear from the fire department a lot and how the growth and the population has increased their response times. And we wanted you to be aware that it's doing the same thing in the sheriff's office, and they have similar constraints. So as we look at the whole budget entirely, we can't just look just at fire. We have to be thinking about the sheriff's office as well. That impacts the same unincorporated area when we talk about patrol. When we speak about detention, that's then the county-wide.
Sure.
So we're having to look at both of those, and they're always rebalancing their positions in order to look at that. So we're not going to probably have this resolved in the next month, but
Gotcha.
it is part of our planning horizon.
Great, great. Yeah, and you know, it's, you know, and I've been preaching about it. I mean, the number one thing that we do here as elected officials is keep people safe. That's got to be the first priority and the first step. And you know, obviously on my side of town, I need more fire stations, but I need more deputies as well. So I'm going to make a commitment to you. I am going to be highly committed to public safety first above all else in this budget cycle. We as a board are going to have to make some very difficult decisions here and cut some things that may not be popular for public safety. I can tell you on the record that I'm going to be one of those that does it. So appreciate all you do, appreciate you being here, and looking forward to working with you to solve these problems, okay?
Thanks. Commissioner.
Commissioner Wilstel?
I just, I wanted to reaffirm my ask to the board. The rancor I get on the optics of how we frame what you get in the budget, what that generates. I want corrections to be separated because it makes it look like you get $700 million for general policing of the community, when we know that that's simply not true, that you're voluntarily providing correction services, that you do not, the sheriff does not have to do that for the community. And I want that separated in our budget so that I don't continue to hear that it's the sheriffs are getting this huge gross amount when it's just, in reality, you're not. So I just reaffirm that to my board members. Thank you.
Okay, I don't see anyone else in the queue. Thank you, sir.
Thank you very much. Thank you, everyone.
Good afternoon.
Good afternoon, Commissioners. I'm not sure to be appropriate, maybe I'll just say ditto to what the Chief said. So appreciate you giving me the opportunity to speak with you today. First thing I want to do is recognize some of the folks here. I came to you a few months ago with some initiatives. It's been a total team effort. The county administration with Bonnie Wise and Greg Horadell. Rob Hendrickson's been a tremendous help with us, and my whole command staff along with our union. So we've been working with this together as a team to be able to present this to you today. So excited to talk with you today and tell you where we're at. During our last presentation in February, we discussed the pressing need to address the challenges we face in response times within unincorporated Hillsborough County. Since then, our team has been diligently working to provide you with an update on our current situation and where we are headed. The rapid growth and historic call volumes in our county have significantly increased the demand for our services. Every second, every minute matters when lives and property are at risk, making it critical for us to reduce our response times. However, the endeavor comes with its challenges, both in terms of capital and operational costs. Over the past 2 decades, the number of calls for Hillsborough County Fire Rescue has more than doubled. While capital costs are currently manageable, the renewal of the CIT could significantly alter the landscape. Ultimately, our call volume and population growth are outpacing our current capacity at Fire Rescue. Looking at our budget, it stands just shy of $266 million, with the majority, 76%, allocated to personnel costs, such as salary and benefits, totaling over $200 million. Operating expenses make up the remaining 24%. Additionally, we have allocated $89 million under the county CIP for new stations, 2 new stations, Station 47, which is Sun City North, and Station 48, which is Progress Village, and also 4 rebuilds, being Station 21 in Thanona-Sassa, Stations 15 in Palm River, Station 10 in Armdale, and Station 13 in Citrus Park. Also, our emergency management warehouse, PSOC improvements, and a variety of other capital projects. Moving into our initiatives, the introduction of the 3-person ambulance is a significant and historical step for Hillsborough County Fire Rescue. By reducing the required response units to critical medical calls from 2 units to 1, we can enhance our efficiency and availability. This not only positively impacts the well-being of our firefighters, but also our citizens. It allows us up to 60% more availability of our suppression units to respond to fire and medical calls to our citizens. Furthermore, this initiative reduces the wear and tear and maintenance costs on our entire fleet, which all of you know is very expensive. 11 ambulances will be staffed with 3 persons at a cost of $2.2 million annually. Currently, these positions will be temporarily staffed through the redeployment of operational funds. The funding for these additional positions is coming from the approval of Station 48's operational costs until the station is built. We've already initiated this effort with 4 units as of April 15th, with plans to extend to 11 units in July. To further improve our response times, we've added peak rescue units, which are deployed throughout the county. These units operate Monday through Friday from 7 a.m. to 7 a.m. till 9 p.m. at night, and are staffed by existing employees who volunteer to work overtime on their days off. We've had the peak units in service for 5 full days thus far, and they are averaging 8 transports during a 12-hour shift. This is incredibly encouraging in our attempt to improve response times and unit availability. This initiative aims to reduce our initial response times by 2 minutes for specific responses while we're creating more additional available units. With an annual operating cost of $4.2 million, we plan to attempt to absorb this with our current overtime budget. Additionally, I've requested $2.4 million in capital funds to purchase units, as currently we're using reserve units for this. The implementation of this initiative began on May 1st, and we're already seeing positive results. I don't think I've, oh, there we go. Recognizing that 85% of our calls are medical in nature, we are seeking to increase our ambulance fleet by requesting 10 additional ambulances. This expansion would significantly improve our response times and unit availability, especially considering that more than 20% of our calls that require response outside our first alarm territory. While the operational cost per ambulance amounts to $1.2 million annually, there is a one-time capital cost of $400,000. However, it's important to note that revenue generated from these units will help offset the operational needs. Finally, we have implemented a system of care transport policy aimed at transporting patients to the closest facility within their designated system of care. This policy is supported by the hospital CEOs and COOs and has resulted in shorter transport distances and out-of-service times for our units, thus improving our overall response times. We have not received any complaints regarding this policy change as it became effective on March 1st. In conclusion, the proposed solutions outlined today have and will continue to enhance fire rescue's ability to save lives and protect property by reducing response times. We remain methodical in our approach to implementation, continuously striving to improve our operational efficiency while being cost-effective. Fire rescue is embracing a solution-focused strategy to meet community needs while navigating financial limitations. We are collecting data to verify and improve these solutions, incorporating input from citizens and personnel, as well as tracking response times. Although additional funding will be necessary in FY26 to roll out the new solution framework, it is anticipated to be more economical than constructing the more than 20-plus fire stations that the current master plan calls for. The forthcoming master plan will pinpoint station requirements and seamlessly integrate effective solutions to ensure a balanced financial approach between operational adjustments and capital investments. Securing the renewal of the community investment tax is essential to support fire rescue's future capital spending. The feedback from our team, and when I say team, I'm being inclusive of all of you here today, our county administration, our command staff, our union, and our citizens, has been incredibly encouraging, and we're already seeing the direct advantages of these initiatives. Yet, we're fully aware we have significant challenges ahead. Your individual contributions will be indispensable in overcoming these obstacles. The transformations we've implemented over the past 2 months wouldn't have happened or been achievable without the support of all of you and the county administration. On behalf of Hillsborough County Fire Rescue and our team, I extend our sincerest appreciation for your support, both present and in the future. That concludes my presentation. I'll be happy to answer any questions.
All right, thank you, Chief. Commissioner Owen.
Thank you, Mr. Chairman. No, thank you, Chief, for being here. And I can tell you from talking to Bonnie, you know, I know that you and the union folks and the firefighters here have been really working with us for solutions, because we know we can't build 20 fire stations overnight. We wish we could, right? So what can we do? We can do better, though. We can do better than what we've been doing. And seeing what you've already implemented since you've become fire chief, you know, yesterday I felt like you guys were following me around. I was at Sherry's, and all you guys, I see you guys back there smiling. I was at Sherry's, and they were there for lunch, and then I had to go out to Apollo Beach. I've come back, and I met some of your rovers, some of your guys that were roving there at a 7-Eleven, talked to them, and I can't tell you how high their morale is in the fire department. I think that's a direct reflection of you and Pep and a lot of you folks, so thank you for that. And I'm kind of reiterating what I just told the other chief, is that, you know, we're going to be committed to public safety here. And while I understand fire stations are a big issue here, I do appreciate the fact that you guys are understanding that, okay, we can't build a ton of these overnight, and we've got to come up with other solutions, and you've been doing that, Chief. So, you know, I just want to thank you for that. Also, I agree with you too on the CIT. We need the CIT to pass. I think we can move some of that critical funding that was going to other sources over to the public safety. I know we still run into the problems of it needing more than just capital improvements, but if we can free up some of that cash, we can afford to pay for some more firefighters to staff. So I'm going to be committed to it, but I just wanted to thank you for working so closely with our board and with us on coming up with solutions other than just a ton of fire stations, because I'm committed to it. I'm committed to building more, but we've got to come up with some other solutions that will help that response time, especially in East and South County, right? I mean, is it safe to say that that's the biggest challenge right now?
Yeah, we have a lot of challenges, but certainly South County is near the top of the list.
Yeah, I know, because our volunteer squad too, we even got out there, and their ambulances are going 24 hours. So, so we appreciate you. Anything that I can do to help, I know that's echoing probably the sentiment of this board that that we're here for you and we're here to help.
Thanks, sir.
Thanks.
Appreciate you.
All right, thank you, Chief. Appreciate it.
Good afternoon, Board. It's my pleasure to have this opportunity to present to you the presentation for the healthcare plan. And actually, I'm actually thrilled to be here. I'm actually thrilled to be here this afternoon because we don't often have this opportunity to talk about the healthcare plan in this much detail in front of the Board. We're going to do a tag team presentation, as was mentioned by the county administrator earlier, with myself, along with the department head of healthcare services, Gene Early, budget director, Kevin Bricky, and our special co-presenter, Dr. John Curran, who is the chair of the Healthcare Advisory Board, and we're glad that he's here with us today. So in a nutshell, our healthcare program, access to primary services, special providing services, providing access to Ryan White resources, providing assistance and access to prescription services, in addition to our newly initiated county healthy living program. Your healthcare program was established back in 1991, so it's almost 33 years old. And back in 91, the board passed an ordinance by a supermajority vote, which gave us the opportunity through authorizing discretionary sales tax to fund the program at a 0.5% funding level to provide services to the Indigent Healthcare Fund. Our program services residents between the ages of 18 and 64, and the plan qualifiers for those folks. Do understand, for those folks that do not qualify for Medicaid or any other kind of insurance or Medicare, and they match the threshold of 175% of the federal poverty level, those folks are eligible for our health care program. Now, over the last 13 years, the board has seen fit to raise those levels due to our recommendations. Starting in 2011, we were at 110%. 2018, we were at 125%. At 2019, we were at 138%. And recently, at 2022, we rose to 175%. We serve an average of about 21,000 unduplicated members in FY23. Now that's 703,000 touches in terms of the different types of doctor visits, inpatient care, prescription assistance, and et cetera. And over the last decade, we're all encompassing. We've evolved over that time to add other services, such as vision care and dental care. Now, realize, and this question has come up quite a bit, the health care program is designed to be a program that's payer of a last resort. So for those folks that have no other means to, provide for themselves, to get health care, that's where we come into effect. Also, be reminded that there's an enrollment every year. It's not like, you're enrolled in the healthcare program and you're there forever. We require re-enrollment every year, and they have to recertify. So that's basically how it works for us. And also, let me point out, back in the early stages of our healthcare program, back in about 1995, this program was recognized by the Harvard John F. Kennedy School of Government for Innovations in Government Award. So that's something definitely to be proud of. As I had mentioned before, this network is broad and very extensive. We have many partner agencies. We work with 13 local hospitals, 30 primary and urgency care units, up to 3,000 specialty physicians, including other ancillary services. In terms of an economic impact, there's been over $1 billion of health care services infused into the county, into Hillsborough County. That also includes annual payments that we're required to make into the Medicaid program, for Baker Act, and for level 1 trauma care. Our partners, again, there are many, and they go far beyond just the healthcare industry. Sheriff's Office, Public Defender, State's Attorney, School District, the Central Florida Behavioral Health Network. There's not any agency that you can't say that our tentacles don't touch when it comes to, being involved in our healthcare program. And quite honestly, it would be impossible for the county to administer this program on our own. So these partners are critical in terms of the magnitude of what it is that we provide. I want to overemphasize this, that, the whole primary focus of this program is to provide, adequate, affordable health care, quality health care to the underserved in our community. Our plan is all-encompassing, and you can see there from the graph there, we have many stakeholders, and again, many of them are beyond the medical community. And we've really emphasized, since the pandemic, we've really emphasized and concentrated on our efforts to enhance the mental health aspect of our program, in addition to the medical side of our program. Now, board members, if many of you are like me, I'm visual, and if I can't be there to physically touch it, I need to see it in front of me. So what we tried to do here with what I'll call this pinpoint heat map was just provide you with some kind of idea of where all of our clients are coming from, where the utilization is. And I will point out to you, District 3 kind of takes up almost 40% of the clientele utilizing our program. If you add District 1 and District 3 together, that's 61% of our clients come just from those two districts. So it kind of gives you an overall view of where all of our clients are coming from that are utilizing this program. So with that, I'm going to turn it over to Mr. Gene Early, our Healthcare Services Director.
Good afternoon, sir. So this slide shows you just a quick revenue snapshot. Shows you the 156.6 million average over 5 years. Projected for this year is 194 million. We also have a couple of other things, interest, 9 million to 11 million, and we also do a robust recovery program from Medicaid and Medicare, and it's about 3.5 million to about 4.3 million roughly. Over the last 30 years, we've been basically at about 5% for our expenditures increases, and for the revenue itself, it's been about 8%. And then when you start and look at it historically from 1991, that's when Tampa General was having some challenges financially, much like the public health hospitals that we have today. And so basically, that was really a big problem for them. So they actually put in a half-cent sales tax. In 1997, they decided to basically cut that in half and make that a 0.25% sales tax. When they did that, it basically stayed that way until 2001, when it basically ended up with the expenditures being below or higher than the revenue, and we were kind of underwater. In 2005, we basically did a study group, which some of you might remember, and we basically had to cut benefits, mainly because we were seeing some things like Medicaid contributions going up, and also because of other costs that are actually always occurring in healthcare. Healthcare is basically impacted by basically economic conditions up and down, basically by demographics, and also by the individual demand of that particular person being served by the plan. In 2007 to 2009, we ended up with a recession. And at that time, we had to cut services again. And during that time period, we were again trying to bring expenditures in line with the revenue. After that, we basically stayed pretty stable with our revenue and also with our expenditures until 2019 in December. Around that time, we basically, if you remember, had COVID. And when COVID hit, we ended up with 20% hits in our revenue for 2 years or almost 2 years. Now that's an aberration, and that's important to note because we don't expect to have 20% increases for the rest of the time that we have this healthcare plan. So as an example of that, in 2023, the increases went to roughly 4%. So if you take a 10-year look back on our sales tax revenue and our expenditures from 2014 to 2023, we're pretty much even keel with the revenue. We basically are pretty much in alignment. And we had a 3% increase there for that particular part of it. And I think it stayed about 5% for the revenue. And then all of a sudden again, when you're looking at it from this 10-year, it basically goes up. And it goes up because of those 2 particular years where we got 20% increase. And then basically our expenditures were less than the revenue that was being generated. And part of the reason for that is the fact that they just increased. But the other part was because the expenditures went down. If you remember, nobody was going anywhere. They were basically staying right there. And that became a problem because nobody was going to the doctor. The hospitals were having issues. They were taking away the elective surgeries, all of those kinds of things. And that's a problem, and that's why we had those high increases. So I'll bring Mr. Kevin Brickey up. Thank you, sir.
Thank you, Gene. As Gene was just showing you some graphs that showed revenue for the indigent care surtax and expenditures, this graph in the red line also shows revenues, and then in the lavender bars is showing budgeted reserves. Those reserves tend to follow with a bit of a lag the revenues and the economic cycle that impacts those revenues. One important difference outside of just economic cycles and the changes in the health plan benefits and such is that the board did decrease the 0.5% sales tax to 0.25% in 1997, and that certainly reflects in a drop in revenue in that red line after 1997, and then restored or returned the indigent care surtax to a half percent in October of 2001. So that dip is mainly due to that change in the surtax rate. And as Gene said, these other areas you're seeing recessions and growth periods. We do see in 2001 that very brief pandemic-induced recession, and then after that, the very strong growth in sales tax due to pent-up demand from that. And those reserves tend to follow that as there's a buildup in balances. The reserves in 2023 and 2024 reflect that. And the budgeted reserves in 2024 are $339 million. And so, of course, we're aware that those reserves have increased and call for some action. There are certain financial options that could be looked at. I mentioned how the board did decrease the indigent care surtax in 97, and that was also a time when balances had grown, and returned it to 0.5% in 2001. That is certainly an option to decrease the tax to 0.25%, maintain service levels, and it would draw down the balances over a period of time and return it to 0.5%. That would require some review and analysis by the actuaries at Healthcare Services, employees to look at this program. It would also require board action, and given recent legislative changes, it would require a referendum to decrease the tax to that 0.25%, and later on a second referendum to increase it to 0.5%. Right now, the indigent care surtax, as Gene mentioned, is roughly at $194 million. Round it to $200 million. Cutting it to 0.25% would be a reduction of revenue of approaching $100 million annually. Now, there are some other options that we have been looking at. And here, this is a case where if having the tax at, remaining at 0.5%, there's some opportunities to employ that revenue in some new areas. One is healthcare for inmates, jail inmates, for those who are appropriate for the program, and of course, we would have to make sure that we would tailor it to those that are appropriate to receive the indigent health care program. We think that's up to $35 million. What that would do is, of course, the detention and the jail operations of the sheriff are funded within the countywide general fund. That would free up countywide general fund dollars and would use instead the indigent health care services to pay for that appropriate amount. And that one thing that could be is that could accommodate or ameliorate a millage swap. As I said earlier, of course, the millage swap affects the countywide fund in a greater amount than the unincorporated fund in absolute value. And then the other area is the indigent care surtax could fund some fire rescue operations that are reasonably attributable to the indigent population. We're looking at studying that and being able to support that. We think that could be up to $5 million. That would free revenue within the unincorporated area fund, because of course fire rescue is already primarily in the unincorporated fund. And so it would free or recover unincorporated area general fund dollars that could be used for other public safety purposes. And with that, I will hand over to Dr. Curran, I believe, or Carl.
Good afternoon, sir.
Good afternoon, Commissioners. It's my pleasure to be here. I'm a physician, trained first in internal medicine and then in pediatrics, and I've had a passion for many years related to populations who are low income and access to health care. I go back so far in this community. I've been here 54 years. I'm an immigrant, and I got very involved. First, we had a cocaine epidemic in Tampa, Hillsborough, in the mid-'80s. It subsided, and we had issues at Tampa General Hospital and its funding and legislative funding, and the Chamber of Commerce, which I was on at that time, put together a task force to work and look at a proposal. Ultimately, it is, as you have heard, the story to get there is kind of interesting in terms of who was before it and how it got voted in. But I have been a member of the Healthcare Advisory Board since 1990, and I just added up the numbers and I'm depressed. But on the reality, what I want to do is tell you a little bit about what's good about it, what I'm proud of, and the investment in community services for those who do not have the means on their own, and particularly as inflation has affected them very adversely in our community. So this is almost unreadable. What I'm going to tell you is we have 4 subcommittees, actually 3 subcommittees, 1 task force, and then we have the Healthcare Advisory Board, which is the voting group that reports with recommendations and requests to the Board of County Commissioners. Items start either from staff or from members of those 4 committees that you see before you. Much of the management committee has related to the information technology advances that have occurred in this field, so we really know what we're doing. And we have an education committee, which is how to reach people, how to get them to enroll. Moderate success more recently with the IT approaches that have been used. And then you see that there's a medical oversight. That's the medical directors of the primary care clinics, 3, Tampa General, Suncoast, Tampa Family, and I meet with them every month and hear what are their issues, concerns, and we take those to the Healthcare Advisory Board. And lastly, we have a behavioral health task force, which has been very, very active. It's been heavily virtual with 50 or more participants because of opioid settlement funds. They're having discussions about how to deal with education, prevention, treatment, and recovery in our community, as we have a very real problem. In retrospect, we really didn't see early in the course of the healthcare plan opioid use and significant behavioral health, and it's estimated that about 40% of adults have one behavioral health issue or another of varying severity. So we've done very well, and I think we have high satisfaction with the patients. We exceed Medicaid performance nationally on a whole group of measures related to cardiovascular disease, medications, do they take them? And diabetes, we have comprehensive diabetes screening. We could be a little bit better on the visual examinations in the older patients, and we've made a lot of progress there. And we have very good primary care access data and timeliness of primary care access. So we have, if I can figure out, I push which button? Help, oh, on the computer. Sure, I know that. Okay, there are a number of things that are under consideration, but there are not recommendations at this time. And it has to be done in the framework of all the budget hearing and your deliberations that come. We have collected data about increasing the eligibility from 175 to 200% of the federal poverty level, and we've have the numbers of that could be affected in our community because they applied, but were over income. Secondly, the item that is very pressing is the short-term residential treatment beds to get them to get patients who need mental health services and education toward workforce out of the jails. The jail is not an appropriate place to try and provide a custodial relationship for mental health. And then we also have forensic SRT beds. I didn't know what they were, but I was educated. There are individuals who are in our prison system who are incompetent to make decisions or care of their own, who await transfer, averaging about a year to the state facilities, if accepted. So that's another one of the items. We have a very interesting program dealing with young adults and late adolescents called the Ybor Youth Clinic. Modest, but has over 2,000 visits last year. And it's been designed by the young people who are for the most part emancipated minors. 50% do not have access to insurance, and to try and get them enrolled in the plan and get them guided toward other community agencies that will help them build meaningful lives and employment. The next is the NOWS program. We're all well aware of opioid use in our community, the things we're doing about it, but pregnant women do have opioid use disorder, and their infants may be affected. And there is a neonatal opioid withdrawal syndrome, and it has potential developmental repercussions if not well managed. And ideally, you want to start with the mother, and the arrangements of the USF Partnership, Healthy Start, and COVE are providing maternal care, high risk this is, to get them to manageable levels and get the newborn infant to not withdraw. They follow these children developmentally to the entry into the school system. They now are close to 5 years in follow-up, and the results are impressive at a modest cost. The last are two things that are important to me. First one is Tampa General. I'm biased. I grew up in Tampa General and matured as a physician there for many years as the director of neonatology and pediatrics and half a dozen other things. And the $3.5 million trauma allocation of 1992 has never gotten an inflationary raise. And we have discussed with them about they take half of the bad debt and maybe we can help with the other half of the bad debt using the Medicaid model for how bad debt is determined, unable to pay. And similarly, over the years, St. Joseph's Hospital has grown a level 2 trauma center and a trauma center for children at their children's hospital, and we are looking at that using the same matching consideration, but we have not voted. We do not have any recommendations to bring before you at this time. And it's already been mentioned about the capital outlay, for instance, that might relate to fire rescue. So with that, I am finished, and I have one more button to push, and it's questions and comments, and they don't want me to talk very long, so I'm going to be brief.
Thank you, Dr. Curran. Appreciate your
Mr. Chair,
comments.
before we go to questions and comments, I'd be remiss. A lot of folks touched this presentation, and I'd just like to recognize them. Mr. Tom Fessler, Mr. Greg Hordell. I think we have 3 folks in the audience. Dean Jessup, Kevin Wagner, if you please stand so you could be recognized so they can see you. Ms. Benson, please rise so they can see you. And most of all, Dr. Curran and the Healthcare Advisory Board. You've already met Gene. I'd just like to thank everyone for, their due diligence in putting this together. It wasn't an easy piece to put together, so I'd like to thank them. We're here for your,
thanks, Carl.
We're here for your questions. And
all right, we'll go into board discussion. Commissioner Wolstel.
Thank you. I had some questions for Mr. Bricky, and I wanted to clear up one thing that was said on the record twice that I'm pretty sure is inaccurate, that the Hillsborough County Board made the decision to reduce the tax to 0.25, but I'm 99% sure that the Senate of 1996 forced the Hillsborough County Board of County Commissioners to reduce it to 0.25. They didn't. I don't believe that they made the decision. I think they filed a bill and forced them to do it.
I think I'm referring to the board adopted ordinances to do such, but
you did say one other thing. You said that there was a recent legislative change that would require different than what's been done in the past. Could you elaborate on that?
My understanding is the recent legislative change requires referendums on the discretionary sales surtaxes, and that it would apply downwards and upwards. Otherwise, maybe I'll let the county attorney comment.
Yes, the governor just signed the law last night, and so effective July 1, this particular surtax can only be done by referendum.
So if I see that the recommendation on one of the slides was that now for us to make that change, it would have to go back to referendum, but are we confidently saying from a legal standpoint that we would be able to continue to make other changes without it being approved by the voters? Are we saying that only the voters have to approve the reduction, but the voters don't have to weigh in and approve any further changes?
The way I read it, and I'll ask Sam Hamilton to correct me if I'm saying something incorrectly, but effective July 1, the only way you can adopt or amend this particular surtax would be through a referendum.
Okay. Okay, because it seemed like the opinion was only on the one slide that it was saying it had to be, but the referendum would be for any of those changes. Okay. All right, thank you very much.
Commissioner Owen?
Thank you, Mr. Chairman. And this could have been on the slide. You can stay up here. But we also pay our portions of Medicaid out of these funds, correct? Do we pay? What do we pay out of these funds?
The Medicaid match is paid. I believe that was about.
Maybe, yeah. I've got numbers like around 23 million.
23 million. There is the level 1 trauma. That's $3.5 million, and the third item.
Baker Act. Around 4.7.
4.7.
Yeah. Yeah, I guess the sticker shock is when you just look and you see what we have in reserves right now. And, you know, I guess the big question is this kind of an aberration because of a situation that took place for a couple years? Or are the taxpayers paying too much, you know? I'm not really crazy about coming up with new concepts on what we can spend money on. And I certainly also don't want to punish groups that are being stewards of taxpayer dollars and not just spending it willy-nilly. So, you know, I do think it's interesting on the inmate situation because by law, by statute, we have to provide health care to inmates. Is that correct?
Yes.
Okay, within 14 days, I think is my understanding, they have to be fully have health care. So I guess, you know, what I'm looking at is, hey, can we source or use some of these funds for other critical needs? You know, we're also burdened by the fact that we couldn't move money within, say, to the CIT, right? Because you can only go half to a full one, correct?
Yes.
So that puts us in that situation too, and we really got to talk to the legislature about not being able to reduce a tax. You know, I get if you're going to increase the burden, and this is just me venting right now. I get if we increase the burden on the taxpayer that has to go to referendum, but gosh, if we have the ability to lower it, I definitely think that's something that the legislature should look at. Would ambulances be something that could be included, that could be considered indigent health care if we're purchasing ambulances? Or I guess we don't know yet. I'm trying to see what we could do with some of these funds. That's kind of a big question, I think, for this board to get an understanding. Okay, well, we've got a windfall of funds, but yet I don't want to rate it because you never know when we're going to need those funds for indigent health care. Suncoast, for example, in my district, very critical to the folks in my district. It's run well, and there's a lot of folks that wouldn't get dental care and get critical health care without this. But at the same time, you know, as a county commissioner, I see these funds sitting here, and I've got critical needs on the public safety side of things. So I guess, and this is, maybe we're just kickstarting this right now, but I guess that's something that I think us as a board are really going to have to know is, okay, what can we really do with some of these funds here in the future, specifically to help with public safety? And then if we can lighten a burden on the side of general funds by paying for something out of this, does that make sense so we can use those funds for critical infrastructure? So I assume we're going to get more and more information on this. This is just the first of the workshop, but I do appreciate the presentation, and Doctor, I appreciate you coming out here and speaking. I'd like you to come back. He gives me warm and fuzzy feelings when he's talking. So, but this is definitely something, and Commissioner Whistle, thanks for your leadership on this. This is something that, that I agree has to be looked at, but I do agree too, it's very delicate. Thanks.
Commissioner Myers.
Thank you, Mr. Chair. I'd just like to thank staff, Jean, Carl, and particularly Dr. Kern, having your 34 years of institutional knowledge about our healthcare program that's been around, and I remember working with you back in the day, and also the hospitals that are here. Would you all please stand so we can see? Because what has been presented on behalf of our healthcare plan is really an educational experience for some of our board members, so I say thank you for taking time to come. As a part of this presentation, and it was shown if we look at slide 5, majority of the individuals, you don't have to pull it back up, resides in District 3. Okay, and those individuals, the underserved, don't have health insurance. And this plan today provides all of that for people who want health insurance. I held the town hall last night. That was one of the, how can I get health insurance? Don't have it for some family members. So this is a program that has been around for 33 years that the late Phyllis Bazansky that brought this and took this to the legislature, and is still standing today. And we look at the number of other agencies from around the country who has made a visit here to Hillsborough County to learn about our plan so that they can implement it back in their communities. This plan is so valuable to our community. And I mean, even the recommendations, and Jean, I'm gonna ask if, and Bonnie, some of the recommendations from our HCAB to see if they can come back soon, because this is another way we can continue to enhance our program. This is all about serving and helping people who's looking for the same opportunities that we have. We can pay for our health insurance. A lot of them cannot. And Jean, you know, back in the day, we talked about those who were at the jail, how can we provide healthcare services to them? And so, and even with our hospitals, if you go in the emergency room today, that's one of the questions to ask, do you have health insurance? If you do not, they enroll you into our healthcare plan. So we want to make sure that everyone that does not have health insurance, they can get health insurance through our plan, because we understand every time we buy something, we contribute to our healthcare plan to help those who are less fortunate. Go ahead, Jean.
Yes, ma'am. It's not only that you're just paying for those individuals, but we're also going to try to connect that with the Orient Road project so that they basically, this will be new. This is not something that we've done before, because you're going to start with them in the, as soon as they get into the jail, as soon as you get into the jail, and then you follow them to the Orient Road where they step down, and these are basically a lot of substance abuse, mental health. They step down into the Orient Road program where they get necessary additional care. And then when they also get all the social determinants of health, and then when they step out into the community, we try to get them a job. We're going to do that for 12 months, make sure they are in that jail. But then when they get out, they go do 12 months worth of employment, and then we know we succeeded a little bit in the program. We're going to track them, and we're going to manage them. So I'll stop there on that, but it's a really innovative and cost-effective program as well. So I just wanted to say that.
Once before we had some case managers over.
We have 3 case managers in the jail to help do this. And we also basically work with the NavCare and our other behavioral health providers to basically work it all the way through the continuum of care. And by doing that, we believe that we're going to make a significant difference in the number of people that end up, for example, in the emergency rooms. Because right now, or I'm not going to say right now, but I know that basically they have been letting people out of the jail with 3 days worth of medications. Now, if you have somebody that's bipolar, has behavioral health problems, substance abuse, where are they going to go? If you don't help them get back into that community the correct way and take care of some of the needs of them, they're going to have They're going to go back to the jail. They're going to end up in emergency rooms. They're going to take up spaces that are already valuable for you or for anybody else that goes to the program that didn't have to go there. And that's why you want to try to do this whole program. It's a good program. We have a lot of statistics that show that the cost avoidance from it, and I'll stop there before Bonnie shoots me.
Or either the chair rolled his eyes at me, see, one or the other.
All right.
But is that the one you're talking about, it's on Orient Road that we were discussing?
It's a continuum of it.
Okay.
So I look at it like that. I mean, it's part of the inmate care. We're going to pay for it if that's allowable for the board. But at the same time, you free up, general funds for other purposes.
Yes.
But I'm not doing it for that reason. I'm doing it for the Orient Road. I think that we need to be one healthcare program during that time frame.
Right.
And I'll stop there.
Okay, and then the last thing I said, we'll look at some funding for mental health, for mental institution that we need to consider having here in Tampa. I'll leave it there. I'll talk to you more about it offline. I'm done, Mr. Chair.
Okay.
Thank you, sir.
I'm sorry. I got two quick questions before I recognize Commissioner Wostel. Bonnie, I guess the first one for Bonnie. Can staff essentially guarantee that if we utilize any of the funding for the health care for eligible jail inmates, that there would be a dollar for dollar increase in the countywide general fund?
Well, we could guarantee that. Guarantee is a very strong word, Mr. Chair. We could do that if you are amenable for us doing that millage swap.
Right.
And so that would be what we would want to do.
Okay. Second question, and this is for Christine. Would any referendum require an audit?
Yes, we believe there's been no change to that provision of 212.055 requiring the OPAGA audit. But I don't know if there's anything more we need to look at, but yeah, I'm getting the head shake that we've already looked at that and it would require an audit.
Okay, so based on that, is there time to do it this year if we wanted to consider that?
So that question arose right as we sat down for this meeting, and it's 180 days before the election, and so we quickly did the math, and it looks like there is not 180 days to comply with the statute in order to do the audit.
Okay. Commissioner Wostel.
Thank you. Yeah, mine was real brief. Attorney Beck, if I'm thankful that you and Mr. Hamilton, and honestly, I'm very sensitive to this population. Most people know that my brother, at the age of 21, my older brother, that meant everything to me, has schizoaffective disorder, and I went through a bunch of pain, money, and suffering to get him to a point of stability after Afghanistan. And it's a trial that we live in with society, and I'm very sensitive to them. But on this list of future considerations, the way I look at them, almost certainly the 200% FPL requests, all of these are essentially ordinance changes that would have to be proposed. Is that correct? I know that when the board did the 175, I think in 2021, that was an ordinance change.
Sorry. I'm a little bit hesitant to answer that question so broadly and then perhaps get something wrong, but we can work with you to identify every potential change and then give you quickly an answer which ones would require it and which ones maybe have some other string. We're kind of getting accustomed to some of these changes, and I don't know exactly what you have in mind.
I would point, some of them, it's something that I personally, this law has some good elements to it. One thing that needs to be fixed, Tampa General serves as the level 1 trauma center for, I believe, like over 4 million people, not just Hillsborough County. They're like the only one in our close proximity on the West Coast. And even I, as a pretty hard libertarian, am okay with getting taxed for some family that's in a car wreck in a rural area that needs a halo flight back to save their life. Unfortunately, when the tax was done, they hard-coded it that if you don't have the hospital lien, they can only get flat rate 6.5 for that service. And if you do have the hospital lien, which we do, then they flat rate it at only 3.5. So I'm not even sure that the ones that increase their level of service, just because it's specifically restricted in hard language in that tax law, I don't even know that you could apply some of these. And I'm pretty sure that most of these would require an ordinance change, which would then require it going to a referendum. So anyways, I'll leave it there then, since I can't get my straightforward answer. But hopefully this tax can, I appreciate the legislature's leadership on this. I heard the comment about an immigrant. Well, one of the great things about America is that you have the right to tax yourself, and it looks like they closed a loophole here. So I'll yield, Mr. Chair.
All right, thank you, Commissioner Owen.
Thank you, Mr. Chair. I'll be real fast. And Kevin, I saw on one of the slides it said up to $5 million to fire. Where did that number come from? I don't remember asking you about that. So what's that number from?
That is an estimate right now, and we have a consultant that will be working on looking at what is most appropriate, because it needs to be appropriate for the services that fire rescue that are attributable to this population.
Okay. Is it something maybe you can't say now that you'll be able to tell me later? I'm just curious why that's an estimate, where that number, how that was calculated, I guess.
I think right now it's we don't want to get too far ahead of ourselves is really what that is.
Yeah.
And that we also looked at some initial data that fire rescue has.
Okay.
But it still needs to be better vetted.
Gotcha. And we're talking about folks too when they get out of jail. Also, when folks are Baker Acted too, they have to be provided certain funding from this, correct?
I'll have to.
Is that?
Maybe Mr. Early can.
Okay.
What was the question, sir?
When someone leaves a Baker Act and they're in an indigent situation, do we provide types of housing or anything for them after the fact, or is that anything that's our responsibility?
It's not. What happens, generally speaking, what happens with Baker Act is, they go in for they can go up to 6 months, but a lot of them end up out in about 3 days. And if they do end up out there in 3 days, then they end up back in the hospital. They go through the whole thing again a lot of times. But those SRT beds that we referred to earlier, that's an extension. You can get to them and put them in secure residential treatments in some cases.
Okay.
Put social determinants around them, and then try to get them out into the community a little differently. And that's what we've tried to do with the one that's basically at Baycare right now.
Gotcha. Great. Well, thank you for that.
Yes, sir.
Commissioner Myers?
Yeah, Gene, I'd like to continue to work with you to champion what we need for our health care plan, because I just really believe it's a part of our economy and helping people that needs health care here in Hillsborough County.
We certainly appreciate this whole board and Bonnie and everyone for supporting the health care plan. Thank you very much for the opportunity.
Commissioner Hagan?
Yes, Commissioner Kim. I don't see your hand up, but yeah, you're recognized.
Yeah, it's up, but thank you. Okay, thank you. I just wanted to say it's been good comments and good discussion and a really strong presentation by staff. I really appreciated Dr. Kern and the whole set of possibilities that he outlined for consideration by the board. I think we'll have to have some time to really look at those. Looks like it could be a combination of different things, but staff as well with the history, the financing, the services, everything else to Gene Earl Harness. That was just a really, really strong presentation. This, I am so pleased that we have this half-cent that we put into medical services here in Hillsborough County when Phyllis Buzansky brought that forward in the early 90s. And it was really noted around the nation for being such a sweeping, strong project. And as you can see, the revenue and the services kind of work together until just recently. But it's really served as, it's not just serving the people on that map where you saw the densities this commission or that commission district, but it's really serving to strengthen the entire medical ecosystem that we all have. It's no mistake that we have a Trauma One hospital in Tampa and for the county, but outlying counties, it serves as well. It's something very notable that we have that's immediately available to us. I'll say as well too that I've seen estimates that up to 50% of those that are being held in jails or prisons have mental health and substance abuse issues. So the suggestion or the possibility of the secure residential treatment, not Baker acting, as Mr. Early said, but kind of secure residential treatment, there's a dearth of that. There's a dearth of that available in our jails and prisons, and really it's a public safety issue because people aren't given that. It's also ends people up in prison, which is more costly, or jail, which is more costly and expensive in all the ways that we've just heard about. So I just I want to thank everybody for the presentation. I think there's a lot of strong possibilities for us to think about here, and it's actually good to have some resources available to be able to do that.
All right, I don't see anyone else in the queue. Just want to thank all the folks that spoke here today and staff for working hard on the materials and the presentation, and excellent board discussion, and we're adjourned.